there's different ways you can do like a BBL without actually going under general anesthesia. I was able to get my body done and embrace the idea and getting away from the stigma of getting body sculpting done or getting any type of cosmetic procedure. And that's how I started with embracing not only my body, the fact that I was able to give birth to a beautiful child, but the changes that came with it and being able to change my body with different cosmetic procedures.
PRP is short for platelet-rich plasma. And so those products from your blood, they have regenerative potential, and that's being directly applied into the area of desired volume and rejuvenation. So PRP BBL, you heard it here. It's going to be the next best thing in gluteal rejuvenation.
Absolutely.
You Are Beautiful, podcast with Jae Kim and Ms.
Welcome to the You Are Beautiful podcast with Jae Kim and Ms. I'm your host, Dr. Jae Kim, a facial plastic surgeon, and I'm on a mission to make the world a more beautiful place. I want to start with you. There are 3 undeniable truths you must embrace to achieve the most beautiful version of yourself. The first is that you are beautiful. The second is that you are unique. And the third is that you are worth it. Let's dive into today's episode. Today, I have with me Miss Lucie Alexandre. She hails from Florida, and she is the owner and CEO of 4 med spa locations called Smooth Body Contour. She empowers women to embrace their most beautiful self and walk out to impact the world in the most beautiful way that they can. She also recently started a nonprofit to help budding entrepreneurs dive in with taking a leap of faith to impact the world with their own businesses. Miss Lucie, thank you for joining the You're Beautiful podcast.
Thank you for having me. I appreciate you.
It's wonderful seeing you and just checking out your Instagram. You know, you represent strong, beautiful woman. Can you tell me a little bit about how you came to embrace your beauty and step out into the world in confidence and impact the world?
Oh my goodness. My journey started. So I was born in Haiti and I migrated to the country when I was about 5 years old. And of course, being brought up in a very strict Haitian Christian environment, you have your whole life mapped out for you. So that's the early beginnings. And the goal was to go to med school. And of course, I fell into accounting. And that was not the plan for my family. No one was really happy about it. And then I opened a clinic, which was okay. But the clinic was mostly dealing with chiropractic care and holistic pain management. And then from there, I had my son about 11 years ago. And then that's when I started struggling with my body. And I'm like, oh my goodness, I'm dieting, I'm exercising, nothing is working. I did the Jenny Craig diet, I counted calories, nothing was working. I couldn't get rid of the pouch. And then that's when the whole boom with BBLs came out, and I started doing my research. I was a little scared at first, and I said, I'm sure there's a better way to do things. So with the help of different doctors that I've connected with and surgeons, we found out there's different ways you can do like a BBL without actually going under general anesthesia. And I was patient 0, and I was able to get my body done and embrace the idea and getting away from the stigma of getting body sculpting done or getting any type of cosmetic procedure. And that's how I started with embracing not only my body, the fact that I was able to give birth to a beautiful child, but the changes that came with it and being able to change my body with different cosmetic procedures. And I tell women, it's okay. It's okay if you want to change your body. Don't let the stigma with body sculpting or cosmetic surgery deter you from doing that to build confidence. And if you don't feel like you should get surgery, that's okay too. Let's just embrace your body how you want to embrace it. So that's how I got started with Smooth Body.
That's wonderful. You were telling me a little bit about your background and the guidelines or, staying inside certain boundaries with regard to how you go about life. And I would say some who share the Christian faith, they
Yes.
say God made you a certain way. Why do you want to change that? So how did you reconcile that?
Well, with me, I think God, I'm big on Christian. Like I have a prayer closet. I pray every night with my son. So I had to combat that, like, okay, is this going against the Bible? Is this going against the Christian faith? But I don't believe God is a God where he wants you to walk around not confident. He wants you to be your true and beautiful self. Now, there's ways you can get your body sculpted where it's not overdone, where it's beautifully, where you can get it done. You can get your body done without overdoing it and putting your health at risk. That's where I do believe it becomes an issue when you know that a physician have told you, hey, you're not a candidate for this. It's not safe for you to do this, but yet you continue to push on the topic. At that point, you're going against God's will for you. That's my belief. But I do think that, God provide all of us with the unique talent, like the surgeons, to be able to do these procedures and sculpt beauties into what they would like to look like and give them the confidence and they need and want. So I don't see anything wrong with that. And that was something that I did have to go through with the Christian faith. Is this something that of God? Is it against the faith? But I don't believe it is. I don't.
Yeah, I agree. And I think that is a question that some people bring up when it comes to their body.
Yeah,
And for me as a facial plastic surgeon, so I do collarbones and up only, right? And especially when it comes to our face and neck, like we're all unique. There's
right.
never been anybody who looks like you, and there never will be anybody who looks like you. And so, kind of like you said, if it's not something too dramatic, and also if it's within the bounds of safety when it comes to procedures, that's kind of along the lines of where I say we still want the result to look like you and for you
Correct.
not to look like anybody else, because one of the principles in the Christian faith is that, like, God made you beautifully and wonderfully. And so I think that's really important for you to still look like just a more beautiful version of you, so that, like
Absolutely.
you said, you're more confident, you can step out into the world and make a big impact in the world. And you're
Absolutely.
obviously doing that with 4 locations of Smooth Body Contour.
Thank you. Thank
So I'm sure there are a lot of happy patients. I'm sure that there's a lot of growing, not
correct.
just within each location, but across the whole company. So what has been some of the more exciting events at Smooth Body Contour over the last couple of years?
Last couple of years, we were able to introduce PRP BBL, which is basically when we extract your plasma when we draw out your blood.
Mm-hmm.
So PRP BBL is basically when we draw out your blood and we spin the blood and extract the plasma. And those plasma, we're able to use it to enhance the buttocks with it. And it's called the PRP BBL. And that new procedure that we actually introduced to the public is actually really taking it off, and our patients love it. It's safe. It's from your own body. It's your own substance from your own body. It's not like you're injecting any type of derma filler. It's natural, and your body can naturally absorb it.
Very cool. So one of the things, I mean, I'm not familiar with buttocks work, obviously, because I do face and neck
Your facial.
only. But in terms of other non-surgical ways of enhancing the buttocks, Sculptra had been on the scene for quite a while. So
Yeah.
how do you feel like PRP and Sculptra are different from each other?
So with Sculptra, it lasts longer than the PRP. of course, both of them are fairly new, so there's still a lot of research to be done on both procedures. With Sculptra, what we have found out is that it does last a little bit longer than PRP, but you don't need to get multiple sessions. With Sculptra, it's a build-on process. It's not a one-time procedure, but with the PRP and the way we are doing it, a patient can actually achieve that BBL look with just 2 sessions. Meanwhile, with Sculptra, you do have to come back and continue with the procedures, get at least 3 or 4 sessions of it with multiple vials. And that could get costly. So
Sure.
we found a way to, one, cut the cost for our patients, and to get them the results that they want immediately. Because at the end of the day, when you're having self-conscious issues with your buttock or your waistline and your hips, you don't want to wait 6 months down the line to see your results. You want it now because you're having those issues right now. So we're able to provide that for our patients.
Very cool. So for those of you guys who don't know about Sculptra, it is a collagen stimulating injection, or a series of injections. And this can be done in an office setting, just like PRP can, without anesthesia. When it comes to Sculptra and the face, we really like to use it for that little bit of atrophy. So into our 30s and beyond, we start to lose collagen, and it happens on our faces, but also it happens in other parts of the body. So the idea behind Sculptra is to help build that collagen back up. And so when it comes to PRP, the difference is that we are isolating your blood products. And so we call them immature, but they have the potential, kind of like stem cells do, to differentiate, to grow, to regenerate. And I really do think that as the direction of aesthetics now, it's really going to pivot more towards that regenerative aspect of aesthetic medicine. Wouldn't you agree?
I agree. I absolutely agree. Absolutely.
So again, PRP is short for platelet-rich plasma. And so those products from your blood, they have regenerative potential, and that's being directly applied into the area of desired volume and rejuvenation. So PRP BBL, you heard it here. It's going to be the next best thing in gluteal rejuvenation.
Absolutely.
All right. So when it comes to someone embracing their beauty, you mentioned that there is a need for self-acceptance over societal acceptance. So talk to me about what that means to you, how it applies to you, how it applies to your patients.
So right now in society, what's booming is the BBL. Everybody wants to look like Kim Kardashian. But realistically speaking, not everyone has the foundation, the body frame to accomplish that look. So it's very important that, one, you embrace your height, your current BMI, and you have realistic goals. So first, you have to accept yourself. Now, of course, there's things that you want to change, and that's okay. Let's say you have a little pouch, let's remove it with a little bit of lipo. That's okay. But you cannot go from a size 24 to a size 2. That's unrealistic. But society tells you that's what you have to look like. You need to be a size 2. So we cannot embrace what society is calling beautiful, because it changes. Back in Egyptian era, the women used to wear those dark eyeliners to make their face slimmer, and they used to do different things. As time changes, the standard for beauty changes as well. So you need to identify what do you consider beautiful and embrace your body. And of course, if you want to make certain changes, you can. But first thing first is basically having realistic goals of how you want to look. That's the first thing. With me, I feel like I look better now in my 30s, my late 30s, than I did in my 20s. And it's because, one, I did embrace my current size. I embraced how I looked. And then the little changes that I was able to make, I did them. And I had a realistic goal. I didn't have I want to look like this celebrity. I wanted to look like Lucie, the better version of Lucie. And I was able to accomplish that. And that made me accept my body with those new changes. If you do not accept yourself for who you are and what you are and how you look, but just making minor changes, no matter how much changes you make in your body, you will never be happy if you're looking at it from the society standpoint, because it changes.
Yeah. So you're a millennial, just like me,
Yeah.
maybe on the earlier part of that generation. But we remember in the 90s where every model was stick thin, right? They were size 0 or smaller. And that was the standard, so to speak. And
It
everybody
was.
wanted to be the stick thin Kate Moss. I mean, she's the first one who comes to mind. But
Correct.
now we see that there are people of different shapes, sizes, colors. Ashley Graham comes to mind, for example. She's taller, she's more fit, she's muscular, very healthy. She is the exact antithesis of Kate Moss, and she's beautiful in her own way. And so I really think that not just size, but also across different cultures, backgrounds, right?
Correct.
I think there's a wider acceptance of that. So when it comes to patients and they come to Smooth Body Contour, what's the experience like? I bet there are some patients who might be shy or might feel a little ashamed, perhaps, to be vulnerable in this kind of way. So what's the experience like for them at Smooth Body Contour?
So first thing first, they always get a consultation, and we want to make sure the patient understand the process. And of course, like you said, sometimes they're really shy. They don't want to show their body. They're ashamed, but we first start off with letting them know it's time to start embracing yourself, and let's go through these changes together. So it is a journey for the patient, because you'll have a patient that comes in, they're intimidated, they're scared, and they're uncomfortable with their body. And then once their procedure is done, you have a patient that's excited, ready to take on new procedures, but also ready to talk about what they're planning on doing next. They're going to the beach, they're going to go to buy a new dress, and you see the difference and personalities between when they walk in and when they walk out. So to start off, we do like to have a consultation with our patients so that we can understand what their goals are. And if they have inspiration pick, we don't ask them for, like, what is your body goals? We ask for inspiration. So we'll know, okay, this is what you currently look like, and this is your inspiration. And then from there, we have conversations with our patients to bring them to reality. If this can be done, we let them know, yes, this is great. We can accomplish it or come close to it. But if it's not realistic, then we have a proper conversation with the patient and let them know what is realistic for you and how we're going to bring out the best version of you versus this inspiration pick, and then bring them a new inspiration so that they can each leave with different type of experience, but the body that they want. So coming in Smooth Body, it is about, like embracing your body, but with the changes that you want with it. Like basically, like if you want lipo, you want a smaller waist and then more wider hips, or you just want a simple lipo. We just teach you how to embrace your body and embrace the changes that's going to come with it.
Do you get a lot of patients who, kind of like yourself, what prompted your journey was after you had your son, right? Your quest to feel your most beautiful. Do you find that a lot of women who come to Smooth Body Contour have, let's say, some kind of life event, some kind of transition,
Yes.
after which they say, I want to start this journey?
We have people from all walks of life, but one story I do remember is a patient that did lose her husband, and depression came, and she just wanted to do something special for herself. And that stuck with me. It just reminded me of why Smooth Body is here, to be able to do something, being in the community, to be able to help people feel good, like feel great, not only feel great, but look great as well. So losing her husband, she fell into a depression, started overeating. That was comforting for her. So she decided to make a change because she chose to live on for him. And being able to do so, she said, you know what, I'm going to change my body, my eating habit. And we were able to get her on that journey to, one, sculpt her body, change her eating habit. And now she's living her best life.
Wonderful. Yeah, especially after, I mean, they can be happy events like the birth of a child, but they
Yeah.
can be sad events,
Sad.
like the loss
Yeah.
of a loved one. And regardless of the transition emotionally, you have a great way at Smooth Body of helping people through it to come out better.
Absolutely.
After that whole situation is done. So you mentioned not just in terms of the physical transformation, but also helping patients through changing diet. Can you talk to us about how that is a part of the journey?
It is. So after each procedure, you do get it's not a diet book, but we give you ways you can actually monitor your eating. We give you, it's called a meal sheet, different meals that would actually help you during the healing process to reduce inflammation. And continuing that diet will actually help you maintain your weight, because although you can get liposuction, whether it's traditional or you can get to mesh liposuction, you still have to maintain it. It's not a diet. It's just a procedure you do. And if you do not change your eating habit, you're going to go right back to where you started from. The goal is for you to get the procedure done and look great and feel great. And continue on your journey of looking and feeling great. So we do provide our patient with a meal plan and ways they can cut on calories, ways they can actually keep up with their new body. And if they fall off the wagon, that's okay. We're still here. We give different options. We also do the semaglutide, the weight loss injections. We have so many different options, but the goal is to change the diet at home and change the lifestyle once you do leave our facility. Because without doing that, you can look great temporarily, but you're going to go right back to it if you're not feeling great and you're not eating the proper nutrition that you need to eat.
Yeah, absolutely. The key to any beauty transformation really is the maintenance afterwards.
Correct.
And when it comes to body surgery, obviously, there's a diet that is most optimal for patients from there on out. And I do think that for when it comes to my patients undergoing facial plastic surgery, for the facelift patients, I always say, leading up to surgery, are you at or near your goal weight? And if they say no, then I'll say, hey, you can wait to lose a little more weight and then get an even more complete lift and resuspension so that you can enjoy an even better result. Because
Absolutely.
the way I kind of talk about it, and it might be crude, but it's kind of like a balloon, right?
Yeah.
And so losing weight is like taking air out of that balloon. When you take a little more air out of that balloon, there's a little more extra skin and tissue to be able to lift just that extra bit. And so patients can enjoy that for a longer period of time. If you contrast that with you get a facelift, then you lose weight, you've already trimmed the balloon so much, and then it just becomes a smaller but deflated balloon. So we make it a point to say, leading up to surgery, if you want to lose so much weight, go for that, then have the surgery. And oftentimes with facelift surgery, I perform fat grafting. And so that's one of the few times I'll go below the collarbone to actually do something, which is harvest the fat from around the belly button or the flanks or outer thighs even, because the two aspects of facial aging are gravity. So our faces come down, although yours will likely never.
Thank you.
So there's gravity and then there's
Right.
volume loss. It's more a component of gravity of things sagging over time, but there's a little bit of deflation that happens with our faces. And so we help both of those components with our facelift. So we oftentimes incorporate fat grafting into those areas. And so for my face, for example, like I know I have good lighting because I want to look good, but
Yeah.
undoubtedly there's aging right there, and there's a little
I
flatness of the cheek right there, and then some hollowing right there. So those are some common areas of fat grafting.
I
And
don't see
so
it.
I know it's the lighting.
For millennials, we look great.
Yeah. Yeah. So the idea is that it's not just about the date of surgery and you can do whatever you want before and you can do whatever you want after. There's a plan, there's intent that goes into the before and after in terms of your care.
I love the fact how you explain it with the deflating balloon. I love that. I'm going to use that analogy for our patients because it's the same concept. If you want to lose weight and we're removing the fat, if you really think about it, your stomach is slowly deflating. It's going to be excess skin, and then from there we will need to have a talk about mini tummy tuck or actual tummy tuck.
Yeah,
So
yeah.
that's a good analogy. I love it. Thank you for sharing.
Of course. A lot of my analogies are based on balloons, how much air is in the balloon or how much skin is on the
Yeah.
balloon, as well as home renovation and cars. I'm
Wow.
not a car junkie per se, but I
Okay.
think everybody understands when I say surgery is like working on your engine and transmission, and
Yeah.
then the car wash at the end is skin.
Hmm.
So I'm sure that a lot of patients who come to Smooth Body Contour have concerns about skin. So what's the
Correct.
approach to optimal skincare in the context of Smooth Body Contour?
So we do not touch the skin as far as like we don't do skin rejuvenation. The most we do is lasers, but we do refer them out. So let's say a patient we have a surgeon that does the mini tummy tucks, but it's not a full tummy tuck. And if they do need a full tummy tuck to tighten up the skin, then we refer them out for general surgery where they're under for a full tummy tuck. When it comes to skin, we do not specialize. We just do like fat grafting with the BBLs and of course with the breast augmentation with minimal downtime as possible. So when it comes to skin, the only thing we can tell a patient is, hey, we're going to remove this fat. If you fall into that criteria where we can remove the excess skin, then we will do so for you. But if you don't, then we will outsource you to someone else, or you just don't do the procedure at all. If we know that you may not be a good candidate for it. Yeah.
Yeah.
We stick to our specialty.
Yeah, a couple of thoughts about that. I mean, the first
Yeah.
is there is so much of there are really so many different arenas within medical aesthetics and plastic surgery.
Correct.
And
Correct.
so there's kind of a need of, specializing in a certain way so that we really level up in that particular niche or in that particular procedure or that particular rejuvenation strategy, whatever it may be. The other part of it is that when it comes to fat and skin, I do think that, if we're too aggressive and we thin out skin, then the skin doesn't look as nice because you
Correct.
want that little bit of fat just under the skin to have that not so
Smooth.
pink
Yeah.
and pruny, perhaps even that kind of effect. So, yeah, there's a good balance when it comes to really working with skin, whether it's topically or whether it's working from, let's say, energy based devices or chemical peels and things like that. But I do think that in terms of aesthetic medicine, a lot of people start with skin. But
Mm-hmm.
when it comes to patients who go to Smooth Body Contour, it's really starting with the figure, right?
Correct.
Okay.
Mm-hmm. Correct. And then we'll just outsource them for skin.
So, kind of going back to patients' expectations, how much of a transformation they want. Another thing that comes to mind is that people should want it for themselves and not for anybody else.
Right. Yeah.
Right. And so, can you tell us about patients who have success while they're wanting it for themselves versus people who come in perhaps for different reasons?
The ones that actually want it for themselves, they actually put in the work after procedures versus someone who's doing it just to appease someone, which we've seen both sides. Both have come in, both patients. And we always find a successful patient that has great results afterwards. They follow the instructions because that's aftercare. After any procedure you do, you have to follow the aftercare. And patients that are doing it for themselves, oftentimes they follow the instructions to the T versus someone who's doing it to appease someone or trying to get a revenge. Like whether they went from a breakup and they're doing a revenge body or, just wanting the self-improvement and you're doing it for yourself, we normally see more success with those patients because they follow the instructions. Like I said, they go through what they need to do after a procedure, following through diets, changing the way of life. It's a big transformation when you decide to do your body and get your body done.
Yeah, I agree. The mindset is totally different from someone who does
It is.
it for themselves and for the right reasons versus,
Right.
let's say, like that revenge situation, like you were mentioning.
Right. I'm all for it, but it's still kind of like the wrong reason. You're still doing it for someone else versus yourself.
Yeah.
And that can become an issue because you're no longer trying to let me look in the mirror and feel good and look good. But it's more so I'm going to make sure this person sees that I look good and feel good. And it's still the wrong reason.
Yeah. The flip side of that. So I've had some patients, and I'm sure you have too, where they say, I think I want it, but my husband doesn't want me to do this because he says I'm beautiful. How do you walk patients through that situation?
So we always try to make sure our patients have consultations by themselves where there's no influence of a husband or a wife or even friends. So it's whatever, we always make sure it's a consultation with the patient by themselves because the same spouse that's telling them, you look beautiful as you are, as soon as you get it done, they will not be able to get their hands off of you. And they right? And they're like obsessed, like, oh my God, you look amazing. So that's why we tell our patients, do this for you. Do not listen to outside chatter about, oh my God, you don't need this, you're gorgeous. Do it for you. Whatever you decide to do it for you.
Yes, amen to that.
Because when you look great, the compliments are going to come and they'll forget that they told you not to do it.
Right.
And we get that a lot too.
That's great.
Yeah.
Why did I hold you back from doing that?
Exactly.
Life after you went through that is, totally different for the person who did it as well as for their significant other. So
Exactly.
And just circling back to that person who does it for, let's say, not the self-motivation, but for some other reason, it just kind of reminds me of, let's say, a child who just has to do something because mom or dad told them to. It's probably not unlike the patient who does something or decides not to do something because of somebody else's message or their voice or whatever. Would you agree with that?
I agree. And one thing I do notice is that when you have it in your head, I can kind of want to do the whole body sculpting. I may want to do surgery. I may want to change my facial structure. I may want to do something. It doesn't just go away. You may get scared or get discouraged by a friend or a loved one, but that feeling does not go away. So you either, just stay in the corner wishing and praying, maybe I can do this, or, holding yourself back from actually getting it done. But it doesn't go away. So you might as well just ignore, just close out all the opinions of others and just do it for yourself. Because I know when I was struggling with my body, it wasn't going away. Like I said, I did the whole dieting. I tried everything, but that little pouch after you give birth, it doesn't just go away by itself. So I just need a little bit of help. So I just need a little bit of help, and that was okay. But that help, that want to fix it, it didn't go away, despite there was people saying, oh, you don't need to do this to your body. Oh, you don't need to do that. It didn't go away. The problem was still there. So I decided to go with it and be able to help someone else, more people, help them with their issues that they're having.
Speaking of your helping people, you're not just helping patients achieve more beautiful versions of themselves. You're helping other people who are aspiring entrepreneurs kind of step out, take that leap of faith. So can you tell me about this nonprofit that you recently launched?
So it's called Lucie Corp. Lucie Corp actually been around for since 2011. I just put a pause on it because I had to grow Smooth Body, but now it's back on, where I do help individuals who are interested not only in the med spa setting, but in any settings, where I help them set up their business. I help them connect with business attorneys, to properly set up their business so they could be protected. I also help them, make sure that they link them with people who will be able to build them websites and be able to get them on a financial journey, like where they're not in debt when they do start their business. So that is something I do at no cost, and I do it for everyone. It doesn't matter if you're a woman, if you're a man, if you're black, you're white. It's just something that I do believe that everyone should, pursue entrepreneurship, because there's so much freedom in it, and to be able to teach other people how to handle your finances when business, because it is difficult. Entrepreneurship is difficult, but when you understand how to balance, finances, how to protect yourself, how to set up a business, making sure you have a proper LLC, and making sure it's registered with the IRS properly, and being able to have someone who is in your corner and giving you guidance, not only on my aspect, connecting you with different attorneys and different entities that will be able to help you grow. So that's something that I'm really, really passionate about and really excited.
Yeah, Miss Lucie is not just a med spa owner. She's also a mentor of people seeking to really launch that next idea, that next big thing.
Right.
And speaking of the next big thing, semaglutide has been a pretty big influence in the aesthetic specialty. So I know you said you offer it. How has it affected, if at all, the practice of smooth body contour?
Actually, it increased revenue for those who don't offer it at their practice. That has practice, you should consider it. We have patients that have higher BMIs, and a lot of times doctors do turn them away and tell them, well, please lose a little bit more weight before we can get you on a table for any type of cosmetics, liposuction or anything like that. For us, we start your journey, whether your BMI is extremely high. We start you off with semaglutide first to get you to your ideal weight, in order for us to start a procedure on you. And whether we put you on a 3-month program, 6-month program, we do offer that before we get you into the whole lipo situation, where you can actually see your results. And, it's a process. Semaglutide is not a one-time thing. It is a process. You do have to follow the diets, of course, and you have to follow the treatment plan that your physician do give to you. And it's not a one glove fits all, but being able to have that that option for our patients, it's been amazing. The results, it is really great. But that whole, what is it called? Semi-glutide face or
Yeah,
body,
Ozempic
it is
face.
a
Mm-hmm.
thing.
Mm-hmm.
It is a thing, which I didn't know. You can lose too much where it
Yeah.
does, it may look a little weird or, strange,
Mm-hmm.
but we monitor our patients so that they don't get to that point where it's just way too much weight, to a point where they, like you said, it's gravity. You had your face like the balloon,
Mm-hmm.
where it's not affecting their facial feature, their body, and it's not overdone with the
Yeah.
semaglutide. Yeah.
Going back to one of the themes we were talking about earlier, as much as people want results now,
Mm,
and PRP BBL is a step up from the Sculptra BBL, semaglutide, I mean, is a step up from any diet we've ever known,
oh my God.
really. But at the same time, and I think this is what you were getting at, is that even with semaglutide, you have to be regimented with the process, right? You can't just
Correct.
willy-nilly this very potent medication and expect good results and expect safety, right? Because safety is a big issue when it comes to this sort of
Absolutely.
thing. I mean, it's fine if you're not undergoing anesthesia for your procedure, but if you are, there's certain considerations.
Absolutely. Absolutely. And there are some patients, we just don't treat them at all, especially after a consultation. We see that you may not be dedicated to following a treatment plan that will be safe for you. Sometimes we do turn patients away and say, we're just not a good fit. And that's okay as well as a practice, just for safety of a patient to say, we just may not be able to help. And that's okay.
Mm-hmm. Yeah.
Yeah.
Yeah, I do think that just like every patient's aesthetic goals might be a little bit different, might be unique. It's every practice is flavor to decide what patient they will choose to accept. And there's a uniqueness in that. And kind of my litmus test is if I like the patient enough where I would hang out with them, have a meal with them, have a coffee with them, I'm much more likely to think that we're going to have a successful journey in terms of their
Correct.
beauty.
I agree. I absolutely agree with that. I agree. Yeah.
Mm-hmm. Yeah. And so for me, the consultation is about learning this patient's motivations, beauty goals, but it is also learning about how the person and I vibe. If I feel like it's not the smoothest vibe, then honestly, I will have second thoughts about that
Absolutely.
patient pursuing their beauty journey with me. Mm-hmm.
Yeah. And I think with patients, it's okay too, as as a practice owner, to say, I see your goal, I hear it, we may not be a good fit. And I think patients sometimes they may get offended, but for your viewers, it's not like getting the right practice, the right physician to do your procedure. It's like going to, like you described, going to get coffee with a friend. Not, it's not a one glove fits all type deal. You got to make sure that the practice you choose and the physician you choose is a good fit for you and your personal goals. So
Mm-hmm.
yeah,
Yeah.
not to take any offense if a physician say, hey, I cannot accomplish this goals for you, but
Mm-hmm.
I can make some recommendations, and then you continue on
Yeah.
your journey.
I agree. Across different locations of smooth body contour, is there a region specific aesthetic that people gravitate towards? For example, you have a location in New England. Are those patients' expectations, desired results different from the ones in the southeastern U.S.?
Absolutely. Oh my goodness, absolutely. Typically in the Boston region, our patients are very subtle. They're not into the BBL looks. They're not really into. They just want to graft, like just remove the fat. That's it. But of course, the further south you go, there's the beach, there's the warm weather. So we noticed that there's a trend where people do want the BBLs a whole lot more as you go further down. Once you hit the Orlando area towards Fort Lauderdale, it's nothing but BBLs. Everybody wants wants the hips, the butt, and of course Atlanta too. That's also big. So Orlando and Atlanta office is one of the two offices where we do get the most requests for BBLs. A lot of the patients in the Boston office, they do ask for the fat transfers to their breasts. That's what they request a lot more, is for breasts augmentations versus the buttocks as you go towards south.
Literally from the top of the US to the bottom.
Literally.
You know, traditionally we have certain preconceived notions of what people want with their beauty or their plastic surgery. For example, the LA aesthetic or the Miami aesthetic,
Yes.
we traditionally think of as different from, let's say, a New York aesthetic or a DC metro aesthetic, because just, you know, of the celebrities we associate with those areas, the lifestyle, of course.
Yeah.
And yeah, a colleague of mine who was on the show said that that's blurring now. And it's that with social media, the algorithm of what plastic surgery or aesthetic procedure results come out to be, it favors a certain look. And generally, the algorithm will push things that have more likes. And so more dramatic outcomes really stop the scroll and get more people to click twice. So he was saying that the more dramatic the outcome, the more people, regardless of where they live, they're going to want that. They think that that's what is beautiful.
That is beautiful.
That's blurring with social media. So I found that interesting.
That is actually good. That's actually is true, because on our page, the ones with the more dramatic buttock, it is what has the popular likes, the more comments, and that's the patients that gets the most requests. Hey, I want this look, I want that look, versus those that has a more subtle look, the more natural look. I think the new trend is going to start in cosmetic. I think a lot of patients, not for facial, I don't specialize in facial, so I have no idea what's going on in facial, but I do believe that a lot of patients are going to opt into more holistic approach versus doing general surgery. Doing like the PRP rejuvenation, as you stated, and I think Sculptra is going to increase as well. Different methods. I think people are going to kind of take a step back from doing like the more aggressive surgical procedures. And that's a trend I see that's happening right now. And it's not because they feel like it's unsafe. It's the downtime, because right now we're always on the go. And unfortunately, when it comes to surgical procedures and you're under general anesthesia, you have to recover. And oftentimes recovery is anywhere between 4 to 6 weeks. So that means that you're missing work, you're losing money. So I do believe patients are going to opt into quicker recovery procedures with quick recovery, where they can get back to work within 24 or 48 hours. Those type of procedures where there's zero downtime. I think that's where the trend is going towards.
That's a very good point. And that's one of the most frequently asked questions, I think, from any patient regarding procedures, even from Botox, which, as you know, the downtime is very, like, it's minutes, right?
Minimal, yeah.
Basically
minimal.
nothing.
Nothing, correct.
All the way over to facelifts, which, and I think people think of downtime in many different ways. I mean, one thing you mentioned is going back to work. And that's a huge element of how people think of downtime. Going back to the gym, going out to eat, basically whatever they like to do in their normal life. I feel like that's what people reference in regard to downtime.
Correct.
So a lot of people in the DC area, they have to show a face publicly, whether it's over Zoom or actually now more so in real life, whether they're on the hill, whether they're in real estate, whatever they may be doing. And so a lot of my facelift candidates say, when can I go back to showing myself in public? And for me, I generally tell them back to, let's say, if you want to go out to eat without a scarf, about 17 to 20 days, I would say. So about half a month, sometimes 3 weeks, but generally that's about the time frame. Of course, you could go with some kind of scarf or a neck wrap if you want. And then I say, if you want to feel comfortable at a public event, like a reunion, a graduation, a wedding, or some kind, generally 2 months, but to be safe, I just say 3 months. And then they can go back earlier at their discretion, assuming they feel more comfortable in their skin, which they usually do.
That's good. Oh, that's really good. I'm learning a lot about facials. Like that's really good. I didn't know that. That's actually pretty good. 20 days to 17 days, that's not bad. 17 to 20 days, that's not bad at all. That's really good. I thought it would be longer for face.
So I think since I two things just off the top of my head is that first, it's generally a smaller surface area compared to the rest of our body. And the second thing is that the blood flow to the facial tissues is more concentrated and more abundant. And so when it comes to healing, the blood flow to and from those tissues that have to heal, I think, is much healthier. I think the limiting factor can be our body's lymphatic system. So the lymphatics all have to go through our neck, which is kind of a limited space. So sometimes that's the limiting factor, but overall, I think people do very, very well.
That's good to know. Thank you for sharing. I'm learning a lot.
You impact a lot of people with smooth body contour. You mentor and help a lot of budding entrepreneurs. And I feel like it's a beautiful life that you live. Can you tell me about an area outside of work where you find beauty?
So outside of work, I find beauty in just hanging out with my son. Like we do a lot of things together. Watching him grow into an actual adult. He's not an adult yet, but watching him going through the stage, he's only 11. For me, I find that it's beautiful. Seeing a child that was just an itty bitty little baby and now it's just an 11-year-old talking kid. For me, that is beautiful. And outside of work, outside of Smooth Body and all the other things that I do outside of Smooth Body, just hanging out with them, watching like on the couch, just watching a movie. For me, that's beautiful. That's life. And I love that. Yeah.
There's something timeless about watching a child grow.
Oh my God, yes. Yes.
while it's quick, I mean, God willing, I'll have a child someday. But I heard
you don't have to rush it.
But I heard that those 18 years can go by really fast. And a lot of people say to enjoy those precious, timeless moments.
So far, it went really fast. It felt like yesterday I was like, oh, I just gave birth and I'm not happy with my body. And now he's 11. So it goes by so fast. And it's a beautiful experience and a beautiful journey. Hopefully you experience it and, it's amazing. Yeah.
Someday, God willing. All right. Miss Lucie, how can people find you? How can people get linked up with Smooth Body Contour and learn more about you and how you contribute to make the world a more beautiful place?
Sure. So you can book at smoothbodycontours.com for procedures, or you can even call the office at 407-864-1260. If you're interested in doing any of my starting your own entrepreneur journey, you can actually just find me on Instagram at Lucie _Alexandre. And I'll be able to assist you. And the website for Lucie Corp will be going up soon. So you'll be able to book a free consultation with me. I do have an assistant that does my schedule, and she'll be able to book you on whatever office I'm in. I do travel between the offices. Mm-hmm. Let's say I'm in Florida and you want to be able to connect and start your entrepreneurship journey, she'll be able to schedule you in.
All right, wonderful. We're going to leave all those links in the show notes. Miss Lucie, thank you so much for joining me on the You're Beautiful podcast. It's wonderful to have a beautiful woman with a beautiful mission, beautiful heart. Really, you impact the world, make the world a more beautiful place. So thank you for all the work that you do. Thank you for being a beautiful person. And I wish you all the best in your future journeys.
Thank you so much for having me again. You have a wonderful day.
Thank you. You too. Thank you, Miss Lucie, for being on the You're Beautiful podcast. I really enjoyed having her on the show to be an inspiration for people who want to step into the aesthetic specialty. Her story really is an inspiration for those who want to make a change in their life, start the beauty journey, and impact the world in a meaningful way. Miss Lucie does this with style and grace and humility, and I really enjoyed talking with her on today's episode. If you want to be a guest on the You Are Beautiful podcast, please email podcast.youarebeautiful@gmail.com. I'll be happy to link up with you and highlight how you make the world a more beautiful place. Again, remember these 3 core truths. You are beautiful, you are unique, and you are worth it. Until next time, take care.